To understand the neurologic, muscular, and circulatory problems that cause migraines and chronic headaches, we must first look at the structures of the head, specifically the jaws and jaw joints. Often referred to as the air traffic control center of the head. The TMJs, short for temporomandibular joints, are located in close proximity to approximately 40% of the nerves in the head and 25% of the nerves that travel to the rest of the body. Because of this dense neurologic concentration, dysfunction in the TMJs can have widespread effects. The TM joints sit at the crossroads of the teeth, jaws, and muscles and are frequently caught in the middle of constant mechanical stress. When the joint's cartilage becomes damaged or displaced, it can lead to bone-on-bone contact. This degeneration commonly results in migraines, headaches, facial pain, dizziness, vertigo, and ear pain. Patients with joint damage can exhibit abnormal joint sounds such as popping, clicking, or crunchy noises during jaw movement. Pain may or may not be present in the jaw joints. Importantly, not all patients with significant joint damage experience joint noises. In fact, many individuals with long-term structural damage have no obvious symptoms because their joints have gradually remodeled themselves without cartilage. As a result, most migraine sufferers are unaware that joint damage is occurring. In many migraine patients, the joints have been compressed for so long that the head of the jaw has resorbed or remodeled itself in an attempt to adapt and heal. These joints have essentially conformed to the damage. These are often the patients who have seen multiple physicians and tried numerous treatments without success, yet continue to suffer from debilitating headaches. Long-term damage to the jaw joints can start a chain reaction throughout the head and neck. When the lower jaw shifts out of its normal position, it puts pressure on the jaw joints and disrupts how nearby nerves, muscles, and blood vessels function. This often leads to nerve irritation, tight muscles, and changes in blood flow. One important nerve affected is the trigeminal nerve, which sits very close to the jaw joints. When this nerve becomes irritated, it can trigger increased blood flow inside the head. This process is a common cause of vascular headaches, more commonly known as migraines. Proper diagnosis of migraine causes begins with advanced imaging, most importantly a TMJ CT scan. Additional diagnostic testing may include cervical spine MRI, EMG studies, and sonography, depending on the individual case. Identifying and addressing the true structural cause is essential for long-term relief. Many different treatments are used to try to control migraines and provide long-term relief. Migraines are not a mystery. They are a medical and dental condition that is often misunderstood, misdiagnosed, or treated without addressing the true cause. When the correct diagnosis is made and treatment is directed at the underlying source of the problem, outcomes improve dramatically. With proper evaluation and targeted care, successful long-term relief is achieved in the vast majority of patients, often exceeding 95%. For more information about head pain problems, please visit our website or contact us at your convenience.